Alpert Medical School at Brown University, and I'm also a co-leader of Medical Students for Choice. I'm speaking today on behalf of the Brown University chapter of Medical Students for Choice in expressing strong support for Senate Bill 274. As physicians in training and future reproductive healthcare providers, we feel strongly about protecting the right to abortion because significant evidence demonstrates that legalizing abortion only leads to negative health consequences for our future patients. History has shown us that making abortion illegal does not diminish the rate of abortion. Such legislation serves only to increase the number of unsafe abortions, which ultimately threatens the lives and well-being of anyone seeking reproductive health care. According to NARAL Pro-Choice America, the American Medical Association's Council on Scientific Affairs shows that legalization of abortion with Roe v. Wade played a significant role in the reduction of the mortality rate from 4.1 to 0.6 per 100,000 abortions between 1973 and 1997. This change is a significant decrease in mortality and shows that the dangers associated with abortion can be primarily avoidable. In 1994, the New England Journal of Medicine stated, "Unfortunately, the prevention of death from abortion remains more a political than a medical problem." In 2017, this is still true. Second, surgical and medical abortion are actually extremely safe procedures, contrary to what many anti-choice groups may proclaim. In fact, studies have shown that abortion is safer than many other common medical procedures, including live births and wisdom tooth removals, as mentioned by Dr. Villavicencio. A study by physician investigators Grimes and Raymond from the University of North Carolina, Chapel Hill, found that mortality rates for abortions were 0.6 deaths per 100,000 abortions, compared to 8.8 deaths per 100,000 live births. Another study by Dr. Ushma and colleagues at the University of California, San Francisco, also found that only 2.1% of abortions result in complications, whereas wisdom tooth removals and tonsillectomies had complication rates of 7 and 9% respectively. Medical procedures, healthcare dangers, and consequences aside, we cannot forget that a majority of Rhode Island residents support legalizing abortion. In fact, according to the Pew Research Center in 2014, 63% of Rhode Island residents support keeping abortion legal. And I and many of the people today in support of this bill are part of that 63%. With the recently appointed Supreme Court Justice Neil Gorsuch and rumors on Justice Kennedy's retirement this summer, it is becoming more and more dangerous for us to simply depend on Roe v. Wade for ensuring reproductive justice for all. As a past resident of Indiana, I've seen the effects of anti-abortion laws and restrictive language on patients' perceptions of safety and health care. Though I may be new to Rhode Island, I know those harmful and backwards ideologies do not have a place here. Rhode Island must actively support and uphold a patient's right to legal and safe abortion to show that anyone needing reproductive health care will not only be cared for, but will also be protected here. Thus, we call on our elected officials today to support Senate Bill 274. Thank you.